How many times have you been to the doctor or urgent care clinic and the doctor has prescribed you antibiotics? The average adult goes to the doctor 4 times a year, and about half the time antibiotics are prescribed. With that being said, something of concern is antibiotic resistance. Antibiotic resistance is when bacteria develop the ability to survive exposure to antibiotics designed to kill them or stop their growth. Antibiotics have been around since the early 1900s and have been relied on heavily ever since. Today, I want to talk about why bacteria are becoming resistant to antibiotics and ways to prevent this from happening. In the 1920s, British scientist Alexander Fleming was working in his laboratory at St. Mary's Hospital in London when, almost by accident, he discovered a naturally growing substance that could attack certain bacteria. This became what is known as penicillin. Antibiotics are used for many things in everyday life, such as preventing infection before or after surgery, preventing infection after any kind of abrasion of the skin, or treating areas of the body for pre-existing infections. Using antibiotics in such an excessive way has led to serious health concerns in our medical world today. The first signs of resistance came up around 1947, only 4 years after penicillin, the first antibiotic, was being mass-produced. With that being stated, doctors and chemists started looking for ways to change antibiotics and prevent bacteria from becoming resistant. The first way I would like to talk about is overprescription by doctors. One study showed that many antibiotics were prescribed for viruses, like the common cold. The problem with this is that antibiotics will not treat viruses, but only infectious bacteria. These 47 million excessive prescriptions each year put patients at needless risk for allergic reactions or sometimes deadly diarrhea, Clostridium difficile. The study also showed that doctors were misdiagnosing patients, thus leading for wrongfully prescribed antibiotics. At least 30% of antibiotics prescribed in the United States are unnecessary, according to the new data published today in the Journal of the American Medical Association by the Center for Disease Control and Prevention in collaboration with Pew Charitable Trust and other public health and medical experts. Another way doctors are wrongfully prescribing antibiotics is when they prescribe a broad-spectrum antibiotic for an infection that could be treated by a narrow-spectrum antibiotic. Broad-spectrum antibiotics treat a wide range of bacteria, while narrow-spectrum antibiotics treat a small range of bacteria. The study published recently in JAMA involved 30,000 children with earaches, strep throat, and other common infections. It found that narrow-spectrum antibiotics generally performed as well as those with bigger targets, but did so with fewer adverse effects. Those were some of the reasons why doctors are causing antibiotic resistance. Now I would like to talk about some of the reasons why patients are causing this and ways to prevent them. Now, when most people go to the doctor, they are prescribed a round of antibiotics to take for 1 or 2 weeks. By the 4th or 5th day, he or she is beginning to feel better and may stop taking the medicine. This does not give the antibiotics enough time to kill all of the infectious bacteria, and some of the time the sickness will come back. Therefore, one would start the antibiotics all over. Taking old antibiotics could also cause bacteria to become resistant. The antibiotic could be expired and not treating the infection the way it should be. Not only does taking old antibiotics contribute to resistance, but it could also lead to greater effects and greater risk of side effects or bad reactions. One last way to avoid antibiotic resistance is to reduce the need for them. Practicing basic hygiene, such as hand washing and lessening the spread of bacteria, will also lessen sickness. Another way is to stay out of public places, if at all possible, if you become sick. Infections can spread fairly quickly, not only causing others to become sick, but you could also come in contact with other bacteria while your immune system is weak and contract a different kind of infection. This quote puts some of these things in perspective about how serious this topic can be. Each year in the United States, at least 2 million people are infected with antibiotic-resistant bacteria. At least 23,000 of these people die. Antibiotic resistance is a serious health problem that everyone should be informed about. Antibiotics are very important medically, and we would not be anywhere near where we are today in the medical field without them. But resistance is a very common and serious topic that everyone should be concerned and aware about.